Hello and welcome to Ndtv, a health show where we answer your questions on various health topics. Today on the show we discuss exercises during pregnancy, and we have right here in the studio Dr. Nutan L. Pandit, who's a founder chairperson of the Natural Childbirth Center from Delhi, and shortly we'll be joined from Mumbai by Dr. Reshma Pai, who's a consultant gynecologist at the Jaslok and Leelavati Hospital in Mumbai. So if you have any questions, please call us at 011-516-33300 or log on to drndtv.com. You can even SMS your questions to us at 6388. Thank you, Dr. Pandit, so much for joining us. Let's first begin. Many women go through this dilemma whether they can actually exercise while they're pregnant. So how true is it the fact that they are sometimes told by their grandparents, the mother-in-laws, etc., not to exercise?
Yes, that's a common belief we have in India. Probably stems from the fact that women did a lot of physical work a long time ago here. They milked cows and worked in fields. But in the urban setting, a woman does need to exercise because that'll help her to feel good. It'll prepare her body for a natural delivery. It keeps her body supple and flexible, and it's very important she does that for her general well-being also.
So, what is the reason actually? Why are women advised to exercise? Does it also have an easier effect on the delivery of the child, really? And does it also make them lose weight faster after the baby is delivered?
Yes, the muscle tone is regained faster after they have their babies. It prepares their bodies for a natural delivery.
In fact, Dr. Pandit, you have a model right here. If you could illustrate how exactly the exercise would help when a lady is pregnant.
Say, for instance, when a woman is full term, that's in the third trimester, in the last 3 months of a pregnancy, the baby kind of sits on her abdominal wall. This is the pelvic structure. And the baby would kind of sit on the mother's abdomen like this, would lie on it like this, like it were lying on a hammock. But when she exercises and tilts this backwards, the baby comes backwards and rests on the bony pelvic structure while she does this exercise. So that gives a respite to the abdominal muscles from being constantly stretched, so that she reduces backache, and she also regains her abdominal tone after the birth of the baby. And also she puts on about 1 kilo to 1.5 kilos of weight on her breasts, and she needs to exercise the muscles that surround the breast so that she retains strength in them so they can hold the breasts more efficiently, so the breasts don't sag. There is also a lot of change that happens in the pelvic floor. It prepares for a normal delivery. And as it prepares for a normal delivery, it gets softened and relaxed, and it needs to be exercised so that it doesn't lose tone. Because if it does, then the woman can suffer from urine incontinence in her middle years when she's about 40 or 50.
That's another problem that pregnant women actually face in the long run, and even immediately after childbirth as well, they have a problem of incontinence.
Actually, when they do this exercise while they are pregnant, they improve the tone of these muscles, they improve the flexibility of these muscles, they open up more easily at birth. After the birth of the baby, when they do this exercise, it promotes healing. And yet again, later when they do this exercise, they regain their pre-pregnant tightness of these muscles. And in their middle years, when they continue to do this, they never get incontinence.
So it's a very good exercise. Helps for more than one reason. We also have now from Mumbai, Dr. Reshma Pai. Thank you for joining us, ma'am, on the show. Very often, doctors advise pregnant women that the first 3 months of their pregnancy are very crucial. Why is this?
See, the maximum number of miscarriages happen in the first 3 months. And because there's even naturally a 20% incidence of miscarriage. And if they exercise and they happen to bleed, even coincidentally, patient will be very upset. So we want to be careful during these first 3 months. So we always advise exercising after the first trimester, from the 4th month onwards.
Also, how long into pregnancy, Dr. Pai, are you allowed to exercise? Can you actually exercise till the 9th month?
It actually really depends on the situation during pregnancy. But if you have a perfectly normal pregnancy, sure, you can exercise or do your normal activities right up to the day you go into labor. Patients all the time, like some of them who are working, for example, in the hospital, the nurses, they do their day's duty and then come and deliver, later in the day. So you can be active right till the end.
Okay. Dr. Pandit, what are the common types of exercises that most women are advised?
Well, I teach a mix of exercises. Some of them are taken from yoga, some from physiotherapy, some from meditation, because I think it's very important for a woman to be happy when she's pregnant, because she influences the baby by whatever she goes through when she's pregnant. So I teach a mix of exercises really, and some are physical, some are relaxation exercises.
Very often we hear the term Lamaze classes that are held for pregnant women. What exactly are they?
Actually, Lamaze is a kind of breathing. It was taught by a doctor called Dr. Ferdinand Lamaze, who went to Russia and learned how the Russians were teaching the breathing, and then he started to teach it in France, and for want of a name they got to be called Lamaze breathing, because he was Dr. Ferdinand Lamaze who was teaching the breathing. So it's really a kind of breathing. It's not people sort of say Lamaze classes, but actually Lamaze is the breathing that's taught in antenatal classes.
And how does that help in the body structure?
No, Lamaze breathing really doesn't help in the body structure. It's totally for labor. It prepares the mother for the labor, prepares her to deal with the labor with the breathing. Dr. Lamaze felt that just like a woman learns to ride a bicycle, she can learn how to handle labor by the breathing.
So it has to be a combination of the breathing exercises as well as the other physical exercises that you should be doing, so that your labor would be comfortable.
Right.
Dr. Pai, there are lots of women who usually don't exercise before pregnancy. They have a quite laid back kind of a lifestyle. So when they are pregnant, are they specially asked to exercise? And for these kind of women, what kind of exercise would you recommend?
I think pregnancy is the time when every woman is really motivated because she wants to do the best for herself and for her baby. So even women who've never before exercised must start during their pregnancy. That's really important. And the exercise doesn't have to be vigorous or strenuous. If you're a woman who's never exercised before, she can do very, very simple exercises, just stretching, relaxation exercises, meditation, learning deep breathing, learning to concentrate at a particular spot, so it's more of an education, it's more of relaxation, stretching. These things help you to relieve back strain, they help you for your simple problems like varicose veins, swollen legs, constipation. So all these little day-to-day issues of pregnancy get relieved by exercise, But I personally feel exercise should always be supervised, You just can't start exercising one fine day. You should go very slow, warm up, then do about 45 minutes of exercise, then again cool down for about 10 to 15 minutes. You have to take precautions like never letting your heart rate go too fast, not more than 140, and not breathe too hard. You should always have this talk test. That means you're able to actually have a conversation while exercising. So if someone can actually teach you the process, it's much, much safer.
Also, Dr. Pai, there are women who are heavily into sports, etc., and probably some of them who do heavy-duty gymming before they get pregnant. Can they continue these forms of vigorous exercises later also during pregnancy?
See, one has to realize that in pregnancy, your entire body changes. There's a release of a hormone called relaxin, which actually completely relaxes your joints and your ligaments. So during pregnancy, when you do jerky movements, there's a much higher incidence of strains and sprains. Also, the back strain is very, very common in pregnancy. As your abdomen has swollen up in the latter half of pregnancy, your center of balance changes, and so you're much more likely to be clumsy and have falls. So you can't really do exercises which you were doing earlier. You can't do that now. So jogging, skipping, playing tennis, these are really not recommended. So also saunas, steams, not recommended at all because they increase the temperature too much.
Also, Dr. Pai, we have an SMS. This gentleman says, my wife has been advised bed rest. Can she do light exercises?
See, the category of high-risk pregnancy, anybody who has, for example, recurrent abortions, who has bleeding in this pregnancy, who has twins, who has a small baby, who has a low birth weight baby at this present pregnancy, so twins, hypertension in pregnancy. These are patients who really cannot exercise during pregnancy. But there are a lot of things you can do, even, for example, while in bed. You can do a little bit of back stretching. You can do deep breathing. You can pull your abdomen in towards the back, so that will give you a little abdominal muscle tone. You can do your foot, just pushing your feet up and down, so the calf muscles will be strengthened. So there are a lot of things. You can do your pelvic floor exercises, the Kegel exercises, which is excellent even while lying down. So there's lots you can do even while lying down, nothing rigorous.
Okay, so as long as you find out from the specialist what you can do, you should actually continue exercising. At this
Yes.
point, we'll take a very quick break. If you have any questions, please call us at 011-516-33300 or log on to drndtv.com. You can even SMS your questions to us at 6388. Welcome back. You're watching Dr. Ndtv. Today we're discussing exercises during pregnancy. We have a caller, Mr. Pankaj Thote from Nagpur. Sir, go ahead. Please ask your question.
Good evening, ma'am. I am Pankaj speaking. My question is, my wife's workplace is 12 kilometers from her residence. Can she drive vehicle during first 3 to 4 months?
Dr. Pai, can she be allowed to drive while she's pregnant?
There shouldn't be a problem as long as the pregnancy has been uneventful so far. Of course, the safety seat belt should always be in place, and we hope that the roads and everything will be okay. We shouldn't have a problem at all.
Okay, Dr. Pandit, we have an SMS here. Someone wants to know whether women who have a backache frequently can exercise during pregnancy.
Yes, in fact, an exercise will help them to cope with their backache and reduce it. So they could...
Are there special exercises for women who suffer backache especially?
Yes, there's something very simple that they can do is just go on all fours and just be like that for some time, because when they are upright, all our organs are kind of wrapped in a membrane and they hang off the backbone. So they hang off the backbone like a flag hangs from a pole when a woman is upright. But when she goes on all fours like a baby crawling, then the organs hang off the backbone like clothes hang from a line in alignment with gravity, and that relieves backache.
Okay,
So that's one
that's
thing.
a simple
one of the
exercise that you
simple
can easily do at
exercise,
home.
yeah.
Also, someone wants to know, does walking help and how long should it be done?
Yes, walking is very good because it gets the blood flowing, and a minimum of 30 minutes, 20 to 30 minutes in a day, after which when the woman comes back, she can put her feet up so that she doesn't get too much of blood pooling in her legs, so she gets the...
Okay, also Dr. Pai, there's an SMS, this lady who's a 39-year-old ramp model says, I'm pregnant for the second time after 2 abortions, and I need to know, do I need to do anything special in terms of exercises for this?
Yes, definitely. Having had 2 abortions, she already gets classified into a bit of a high-risk pregnancy. So if she's a model, she really needs to take care of her figure and her weight. I think it would be really a combination of nutrition, being careful during pregnancy to not put on too much weight, as well as some form of supervised exercise. Definitely not anything very weight-bearing, for example, not too much of brisk walking and all, but lying on the back, doing pelvic floor exercises, doing back stretching exercises. These are the things that she can do safely, but nothing vigorous at all will be recommended.
Yeah, and considering she is 39 years old, I think she should just go in for a specialist opinion before she starts something on her own. We have another caller, Mr. Devendra Singh from Delhi. Sir, go ahead, please ask your question.
Hello.
Yeah, go ahead, sir.
I have the questions. What types of exercise should be really preferred, like back bending, forward bending, stretching exercise? What types of exercise?
Dr. Pandit, what are the kinds? They want to know more exercises for women who are pregnant.
Well, there's the bust exercise, the pelvic floor, there's an exercise for the joints of the ankles, there's relaxation, there's the shoulder rotation, and with lots of exercises.
In terms of stretching, everything that you used to do earlier when you weren't pregnant, like toe touching or stretching your hands up in the air and all, are those still allowed, or should they definitely be done under consultation?
Under consultation, yeah.
Okay,
Because
so
of the changes that happen in the pregnant body, the entire body relaxes from within. Not only the joints, the blood vessels also relax, the muscles, and it's all very relaxed. So one has to keep that in mind. I do
So
have
even
a
if you're
book
doing
where I've
simple exercises, it's
explained.
preferable that you ask your gynecologist or a physiotherapist before you actually go into doing it. Okay, we have another caller. It's Mr. Tarun Goda from West Bengal. Sir, go ahead, please ask your question. Mr. Tarun, can you hear us?
Hello.
What?
Please ask
Hello.
your question.
Yeah. No more questions.
Okay, I think we probably have answered his question. Another thing, Dr. Pandit, is it possible for a woman to continue exercising from the point of view of losing weight while she's pregnant?
No, pregnancy is not a time to lose weight. It's a time to maintain abdominal tone, get a kind of aerobic effect when you walk so that the blood flow is good, stuff like that, but not a time to lose weight.
Okay.
Yeah.
Dr. Pai, what would you advise someone who has been very conscious about weight, losing, etc. before being pregnant? What would you advise a woman like that?
See, the ideal time is obviously to lose weight pre-pregnancy. But if the patient goes into pregnancy fairly overweight, the one thing we do suggest is do not put on the normal amount of weight. The normal recommendation is about 11 to 12 kg weight gain throughout your pregnancy. So if a woman is already overweight, she can definitely put on much lesser, just a couple of kilos, or sometimes even practically no weight gain during pregnancy. And this has to be done primarily through eating a very, very healthy diet, being careful to cut off all excess calories, because the child is very rarely deprived. The child gets its nutrition from the mother. And as long as the mother is eating a reasonable intake of calories, supplements in terms of iron and calcium, she can provide for herself and for her baby without too much of calorie intake. The exercise has to be, again, supervised. So exercise cannot be too much during pregnancy. Exercise has to be moderate, calories have to be controlled, and by both these combinations, we can keep the weight in control.
Okay, at this point, we'll take another very quick break. You're watching Dr. Ndtv, and today we're discussing exercises during pregnancy.
Ndtv, brought to you by World MBBS Tour, OrbitFoundation.com. Orbit, exploring the doctor in you. LG Care, life's good. Hicks Thermometer, the right degree of truth. And healing people, changing lives. Dr. Batra's super speciality homeopathy.
Welcome back. You're watching Dr. Ndtv, and today we're discussing exercises during pregnancy. Dr. Pandit, there's an SMS. Is it a myth or is it true that women cannot lose weight after giving birth to a baby?
It's a myth. Women can lose weight, and what's very important is that they do very mild exercises in the first 6 weeks, because that's when the body is still soft and pliable from those relaxant hormones, and they respond very well. They're like plasticine. You can mold them, and you can gain tremendous mileage if you exercise in the first 6 weeks. Very mild exercises.
So it all depends on how well you're keeping yourself while you're pregnant, and losing weight after delivery depends entirely on that.
No, after the delivery you can start the exercises. Even if you've not exercised in pregnancy, that's fine, yeah. It's just that your body is so soft and pliable that you take advantage of that. And there are very simple exercises, like you stretch your leg and then you bring it right back and you stretch it down, and that brings, there are muscles in the abdomen, on the abdomen, that spread apart like this, and there are muscles that spread apart like this. We need to bring these back and we need to bring these back. So when we do the stretching of the leg, it gets these muscles back. And there are if you just do simple deep breathing right up to your abdomen, it'll get the muscles back. And you've got to use that time in the first 6 weeks.
So you have to actually exercise. I think that's
Yes.
the key to it. Dr. Pai, we have another SMS over here. A lady wants to know, in the first trimester, can a woman go to a hill station?
See, normally during the first trimester, we prefer to avoid traveling, because traveling, particularly in India, sometimes the conditions are really not that nice, particularly hill stations. The roads are not that good. More than anything else, the facilities sometimes in the smaller hill stations are not available in case of an emergency. So I would really never recommend traveling, particularly to not so main towns in the first 3 months.
Okay. Also, Dr. Pandit, someone here wants to know an exercise to be done at home that can tighten the breast after delivery.
After delivery, you should not do breast exercises because you're breastfeeding. All breast exercises should be started after you stop breastfeeding.
Okay.
But while you're pregnant and after you stop breastfeeding, you can do a very simple exercise by just joining your hands like this and pressing them together. Make sure they're not touching your body, and you'll feel all the stretch on the muscles here. They are the muscles that support your breasts.
Okay,
But not when you're breastfeeding.
definitely not when you're breastfeeding. It should be all started. And that too, would you need to go and take advice after that, or can you just start it blindly after exercising after you've finished breastfeeding?
It's always good to take some guidance when you exercise before you start off, just to make sure you're on the right track.
Okay, Dr. Pai, Praful from Goa wants to know, do exercises really keep the baby healthy also in the womb?
Definitely, because a moderate amount of exercise improves your circulation, and there's a greater amount of blood flowing to the uterus, to the placenta, to the baby, and so there is an improvement in baby circulation. There are studies which say babies are less, they're better in size with moderate amount of exercise, and also the labor process is easier, so obviously the baby benefits if your labor and delivery is easier. Of course, too strenuous exercise will take away blood from the uterus, and then it goes to your legs or to your hands if you're doing weights or strenuous exercise, or if you're taking saunas and steams. That takes away the blood from the uterus and from the baby, and so that's not recommended.
Also very quickly, Dr. Pai, someone says that does the sitting posture also make a difference? Can a pregnant woman sit cross-legged?
The most important thing in pregnancy is posture. Whether you exercise or not, your posture is important because the center of gravity shifts during pregnancy. So if you can more or less stand, for example, with your feet apart and the entire body, the center of your body being just above the arches of your feet, that's the single most important thing. Sitting cross-legged is very good. In fact, it stretches the inner thighs, stretches the groin, and in fact gives you that flexibility which you will require during the labor process. In fact, we recommend squatting towards the latter half of pregnancy. You can do supported squatting, as in sitting on a low stool and then stretching out the thighs and getting the inner thigh stretched well. So these are in fact very positive exercises for helping in labor and delivery.
Okay, we're completely running out of time. Thank you so much for joining us, both of you, today. If you want more information, in fact, you can log on to our website, that's drndtv.com. For now, news continues on NDTV 24/7.